Hi, I'm Dr. Stephen Adorn, and welcome to the health segment of Western Wisconsin Journal. I'm a family practice physician here in Hudson, Wisconsin, where we film our show. And thanks for listening today. It seems my show is turning into somewhat of an editorial page. I have a couple of topics today that might be a little controversial, but as they say, controversy makes good press, and it might keep your attention a little bit. The first topic I'm going to talk about is that the AMA came out with a statement that, quote, patients come before profits. Well, that kind of makes sense, that patients' health are really important. But why did they come out with this? What are they concerned about? The AMA is, of course, the American Medical Association. But many independent medical groups have been snapped up by healthcare organizations. I'll give you a few examples. Health Partners runs Hudson Hospital. Hudson Hospital used to be independent, but it didn't have enough capital to survive, to build a new hospital, get expensive CAT scanners. The old Hudson Hospital was independent, but it had to compete, so it had to go for the deep pockets of Health Partners. Recently, Health Partners scooped up Park Nicollet Clinic. As I recall, that clinic's been around a long time, and it was founded, I believe, by physicians. So that's a little concerning. Allina, another large healthcare organization, runs River Falls Hospital. Health East, another biggie, has been running clinics that were once independent. As a result of the merger of these doctor healthcare organizations, the AMA is concerned that more doctors working for a corporation will be influenced to change their practice patterns. For instance, I read about an emergency room situation where the corporation evaluated the different doctors to see how many admissions they did from the emergency room to the hospital. And one of the emergency room doctors was reprimanded for not admitting enough people to the hospital. Apparently he was an outlier. And they said, you got to admit more people to the hospital. Well, who holds the purse strings? The corporations. These ER docs work for the hospital, and they're telling this doctor how to do his practice. When I was in residency, we were taught to practice medicine that was to conserve costs. Don't order tests unless you're going to use them or you really need them. Don't do procedures unless there's a high percentage of them working. Just don't do them because they're there. And that's a concern. That's what AMA is concerned about, is that they're influencing, these corporations are influencing the doctors' practices to make more money. Certainly, government payer insurances like Medicare and Medicare can be big losers for hospital organizations. Will these patients get the same amount of expensive testing? Will they be hurried out of the hospital after being admitted so hospital corporations can make more money? I want to comment a little bit about this. A lot of times when somebody comes in to the hospital and is a government payer, the government will only pay so much for that diagnosis. So appendicitis or something like that, they'll pay. So the quicker the hospital can get the patient out the door, the better. And the more money they'll save. However, the government now says if that patient gets out too soon and is still too sick and gets readmitted, the hospital can get in trouble for that. And the government had to do that because they're sending people home too early. Once again, money influencing doctors' practices. On the other hand, will doctors be encouraged to order more tests in order to boost corporate profits? So if somebody has a good paying insurance, well, we'll add a few more tests on here, make a few more dollars. Now that healthcare organizations often employ the doctors, the hospitals control the salaries and perhaps the autonomy of the physicians. I've seen this corruption at our hospital in Hudson. My patients who are in the hospital are being referred from the hospital to health partner physicians. For instance, an internist, maybe a cardiologist that works for Health Partners. Now, those patients should be referred back to me or to one of our specialists at the clinic. You see, Hudson Physicians is an independent clinic. Ask your physician if he is independent. Chances are he isn't. He's probably salaried or works for one of the big healthcare organizations. Unfortunately, I've had patients who think they're going to an independent Hudson Physicians when they're going to a health partner clinic. They don't even know that they have the option of going to the cardiologist of their or their family practice doctor's choice. Physicians get paid mostly by the quantity of their work. If doctors are salaried by how productive they are, for example, bonus level of production, you have to make so much production, and you make so much production, bring in so much money, you get a bonus in your salary. Well, if they're trying to crank out patients, as we say, how much time do you think the doctor will spend with each patient? Certainly in independent clinics, they make more money when they churn out patients, but it's their choice to do that. The quicker you see a patient, usually the quality of care goes down. An independent doctor can decide how much time he needs to do a good job. If the doctor works for a corporation, the corporation sets the goals for the doctor's production. It's not a good situation for patients. Chances are that because doctors are working for large healthcare corporations and may not be happy in that position, we may see doctors unionize and even go on strike. That's not a good thing for anyone. So that the first topic that I wanted to talk about, corporations influencing the practices of doctors. And that's what the AMA is really concerned about. Quality of care goes down for profits. I think the government's concerned about that as well. The other topic I want to talk about is a really hot one. It's about mental health and some of the ramifications of not treating the mentally ill. Recently, a woman jumped off the Hudson 94 bridge into the St. Croix River to her death. She left her young daughter behind in the car. Recently, we all know about this. 20 children are shot and killed in a Connecticut elementary school. Recently, a woman pushes a man off a New York subway platform to his death by train just because he was of a different nationality, creed, whatever. And one of the stories that concerned me, this is a little bit older, that over in Minneapolis, a veteran decapitated his mom. Who are these people? Why did they do such terrible deeds? What can we do to stop suicides, mass murders, and senseless homicides? Some of these misfortunes are unavoidable, but over the years, mental health care has suffered under a lack of funding. The pay for psychiatrists is very poor, making them scarce. I've been in Hudson for 20 years, and we have not had, except for Dr. Sletton, who was around occasionally, local psychiatrists that we could use, just even to cover western Wisconsin area. When I worked the emergency room, when we had a psychiatric case come in, we'd have to call the police to come in and do a hold on them. They'd have to bring them over to St. Paul or a faraway city in Wisconsin. So we just don't have good facilities for the mentally ill. I'm not a psychiatrist, but about 30% of my practice is psych-related. Treat a lot of depression, manic depression. The need for mental health access must be met. Money needs to be put towards the mentally infirm. We want to try to avoid these tragedies of killings by mentally ill people, but we need to put the money there. We can't avoid all of these misfortunes, but we've got to do something about it. And you can discuss guns to be blue in the face and nobody's going to be really happy. But I will say automatic weapons are not a necessary thing to have. Not all of these tragedies can be averted, but we could partially blame the deaths on people that, or parties that don't want to put the money forward. I think we all be happy to pay a little bit more taxes so that more money could go into mental health care, so that maybe we could avoid one of these terrible incidents like happened to those poor school children in Connecticut. Well, that about ends my show. We talked about the AMA's concern about profits from corporation coming before care of patients and how they're going to influence doctors to change their practices. And then we talked about the tragedies caused by mental illness, including homicides, suicides, mass killings. And like I said, there's no good answer for stopping people from killing other people. They can borrow guns. They don't have to buy them. In today's atmosphere, if somebody's going to buy a gun, it'd be nice if you could check if they're dangerous. And they don't have to have a criminal record. They could be deemed dangerous because of the mental illness. But because of HIPAA laws, which restrict the privacy of the individual, the government doesn't know that this could be a potential mass murderer getting a gun. But like I said, you can get guns off the street, you can get them from family members, you could steal them. It's not an easy question. But I think if we put a little more money towards mental illness, I think we may be able to save a few people. Thanks for watching. I'm Dr. Adorn.